This is the hip flexion bent knee assessment. This one's really good for locating any sort of impingements that you might have in the hip, and it allows us to figure out maybe the best sort of foot placement for movements such as squats. So we're going to start by lying down flat on our back. Now, sometimes we can have this lumbar arch. We don't want to have that. So we're setting this little bit of a posterior pelvic tilt. We're making sure the lower back is flat on the ground. From this position, we're going to straighten one leg, and the leg or the hip that we're going to be testing is going to be this bent knee position. Now, you want to be able to reach your hands around the front of the knee like this, but if you struggle, if you're so inflexible at the moment that you can't reach, you might need a towel, or you could potentially use a strap from a gymnastics rings, or you could use like a TRX or something like that. The strap needs to be taut. You don't want to use a resistance band here because obviously the band is elastic. So the hands go around the shin if you can reach there. And what we're looking at first off is we're looking to try to pull the knee towards the shoulder. So this is a nice straight line, and we're trying to close this angle between the thigh and the torso. So I'm grabbing the knee and I'm just pulling myself into hip flexion here, keeping the lower back on the ground, keeping both shoulders on the floor, and just being able to hold this for 15 to 20 seconds. Do you feel any pain, any pinching, any discomfort in and around the hip? If not, that's all good. If so, then make note of that. After you've done this one, what we're going to do is we're going to repeat the test, but now I'm going to pull the knee towards the outside of the shoulder. So it's not straight down, it's just slightly out in this direction. I'm still trying to close this angle between the thigh and my torso. It's just that the knee is tracking slightly out in this position. Again, closing the angle, holding that for 15 to 20 seconds, and making note of any pain or discomfort that I feel in the hip. If that one's good, we release it, and then we're going to do one more where we're really going to try and pull the knee out to the side as much as we can. So I'm allowing the hip to open, and I'm closing the angle again and pulling into this position. I'm keeping the opposite hip on the floor. So I'm not allowing the torso to rotate or twist, and the back of the opposite shoulder is also staying on the floor. So we're closing that angle, but we're pulling the knee out to the side. Do I feel any pain or discomfort in the hip? Holding that 15 to 20 seconds. Once we've done that, we'll straighten that leg and repeat on this side. So the first one is pulling the knee straight towards the shoulder, working on closing that angle. The second one is pulling the knee to the outside of the shoulder, again closing the angle. And then the third one is allowing the knee to fall to the side, keeping the hip and shoulder down, and again pulling and closing the angle as best we can. When videoing this one, you want to video from a side view so that we can see how much you're able to close the angle between the thigh and the torso. And really what we're after is just you being able to connect and understand the feeling that you're getting in the hip. If the hip capsule feels fine in all three positions, that's great. If there is a position that causes you any pain or discomfort, then you need to make note of that position. And like I said at the start, this can affect movements such as lunges, step-ups, and our squat pattern. This is the hip flexion bent knee assessment.